Good morning. I hope everybody can hear me all right. We have about a few more minutes. I know that we have a few people in, and of course the F-35s are going over. So we're just gonna wait for a few moments, have a few more people join. I'm gonna go ahead and remute myself so you don't hear the jets go over, but welcome to our Care Navigator user group meeting. We're just gonna pause for a few minutes, have a few more people join, and then we'll get started. All right. I'm gonna go ahead and unmute myself. Fingers crossed that the jets are out for the day. Trying to see if Robin's on or Denise are going to monitor the question and answer portion of this. So we'll hold on that until after, and I'll check in to see if there's any question and answers after I go through some of the slides. Just going to go over our agenda for the day. Is that really the overall thought for this Care Navigator user group call is to go over some items that might be helpful for to wrap up kind of like the end of year care coordination efforts. So I'm going to go over some of the technical components that may be helpful to look at for end of year, just kind of thinking about optimizing the workflow and to wrap up any loose ends for end of year. So I'm going to go over, as you can see on the screen, I'm going to show you the Care Team Conference. Just going to go over some details of that, where it is in Care Navigator. I'm going to go over the shared care plans referring to the filtering functionality. So there's just some filtering tools that you can use to ensure that there's a shared care plan for anybody that you are on the care team for. And then you can also see if there needs to be a lead CC assigned to anyone that might have a shared care plan already. So we're just going to tie up that and see how we can look through that. Always helpful reactivating care team members. Just a review of the prioritized patient lists that are fairly new. So just going to go over that, where it is, and then just a little overview of where the resources is. So it's kind of a standing item on our agenda. As a reminder, this is recorded. We do record it and then upload it onto our OneCare website. So we'll do that. Usually it's up by the following Monday, and they live on there for about 2 months until our next Care Navigator user group call. So I'm going to go ahead and get started. I'm hoping that Denise or Robin can interject if there's any question and answers or questions. So I will go ahead and start demoing the Care Team Conference. Okay. So I have Care Navigator open here, as you can see, and I'm going to go ahead and go into a test patient. We are in the testing environment, so all of this information is not live or actual data. They're all test patients. So I'm going to go in and just show you the Care Team Conference and just basic overview of that information. So I'm just going to pick someone here. One moment. Okay. So I'm going to go into my active patients and select somebody that I am on the care team for. I'm going to go down here. We have Juliette Albertson. I'm going to select Care Team Conference. You can see there's some Care Team conferences that are already in there. Now I want to add a new one, so I'm going to do the plus sign. And that will open up a new window. And with the visit type, you want to be sure to select the Care Team Conference functionality. And with that, it will open up the other functionalities below it. And just kind of go ahead and fill out the following information. If patient and family are invited, I'm going to select yes. We have patient family attending. I'm going to select no. And once you do that, it's just going to pop up the reason for not attending. And I'm going to do schedule conflict. And down here, we continue with the encounter purpose. You can select one or many of these. And since we're going over the prioritized patient outreach, we can select that. And then I'm going to also select some goal setting as well. I scroll back up. You see the patient right there already. And I'm going to select attendees. Let's see. Oh, sorry. Now I need to add the encounter note. So I'm going to say meeting. So meeting with patient to goal set. Now, just an information, the encounter notes, this is not to be a copy and paste from an EMR. We want to make sure that the goal of this meeting is we make it brief and add any action items if needed. So I'm just going to hit the save button. This takes a minute here. All right. So I'm going to go up and add the attendees now and click the little grid view. Add attendees. And right here, you can either select all as attending the Care Team Conference or just a few. So I'm going to select myself and one of my colleagues. Do OK. And then I'm going to close that. And if you click up here, it's going to bring you right back to the Care Team Conference window that you were in. So you want to click the patient's name up here. And if you click down here and you hit refresh list, so you want to right click, refresh list, and you'll see it populate with Danielle and my name. So that is all set. And something of note, right here you can do in progress, or if this is all set and the Care Team Conference does not need to be edited at a later date, you would go ahead and hit completed. but just to note that once you hit completed, you cannot go in necessarily and edit or append. So I'm going to go ahead and just hit completed. Just say that we have completed that and hit the save button right down here and close this window. And you'll see that the Care Team Conference is completed and all that information has populated down here. I don't know if Robin or Denise are on, if there's any questions, or if I can keep on going to the next slide. We'll just pause for a second.
Okay to keep moving forward, Erin, and we can address any questions that come up at the end.
Okay, good. I'm glad you're joining us. I was like, I'm not sure if they're on, so I'm glad that you're here. All right, so I'm going to go over just the shared care plan functionality. That will be helpful to just make sure that we have the shared care plan information completed. So I'm going to just go back to the active patient list. So do the drop down and do active patients right here. Now for this demo, I'm going to go ahead and see and make sure that any folks have anybody that I am a lead CC on. So any folks that I am on the care team for, and I am the lead CC for, to ensure that they have a shared care plan that's created. So I'm going to go ahead and hit the filter. I'm just going to scroll over and go to lead CC. So right here, I'm going to click the drop down. I'm going to hit filter by specific lead CC. And just a note, it is kind of, it's easy to overlook. You want to make sure when it says look in that you click all active providers, all active care providers. So that's going to pull up any folks that are active on care teams. So you want to make sure that it says that. And I'm going to select my name for this. Okay, so my name popped up. I'm going to hit select. So you hit the check mark, hit select. That will populate right here and click add. Not many popped up, but that's all right. So you'll see right here, it does. I do have, I am assigned to a patient. I am the lead CC. And here you want to ensure, so you'll see that there's a shared care plan initiated. What that means is that I have started a shared care plan with this patient, but I haven't completed it. And what we really want to see is that the shared care plan is completed. So what we're looking for here is that there should be a shared care plan created date. So what I would do is go in and create a shared care plan and complete this shared care plan for this patient. So I'm just going to pop in here and just show you what that looks like. I'm going to click care plan. And you'll see for whatever reason, see the status is not started. So once I change that, it will start and complete that shared care plan. I'm just going to back out of there. I don't want to get too deep in that. Okay. So that is why there's no date here, because it said it had not started that. So once I do 2 goals and 2 tasks on there, it will show a shared care plan is created, and that will kind of close the gap on that. So I'm just going to go back to the My Active Patient list and turn off the filter. Perfect. So now I'm going to see if there are any folks that are missing a lead CC that might have a created shared care plan. So to do that, I'm going to click the filter view, which is on already. I'm going to click down to the shared care plan created. And we want to select contains data. So this is going to return all folks that have a completed shared care plan. So you'll see there is a date for initiated, which means that this is started. And then you'll see the shared care plan created, which means that it has been completed. So that is a successful shared care plan. However, we want to ensure that a shared care plan also has a lead CC. So you'll see some of them have a lead CC and a created date, which is great. That's what we're going for. However, you'll see some that have a initiated and a created date that do not have a lead CC. So what we want to do is kind of bridge the gaps and make sure that there's a lead CC in here. So to clean that up a little bit, we want to see folks that have a created date but do not have a lead CC. You can just click down on the lead CC and it says contains no data. And you can see here, this is returning all the folks that do have a shared care plan completed, but they do not have the lead CC. So what we would want to do is go ahead and assign a lead CC to any folks that have the shared care plan created date, but do not have a lead CC. So we would go in and assign a lead CC for that. And I can just demo that really quickly as well. So I clicked a patient that did not have a lead CC, but did have a shared care plan created. So I'm going to go ahead and assign a lead CC real quickly. So you'll see they do have a current care team here, but there is not a lead CC identified yet. So I'm going to go ahead and click the grid view. And I'm going to add a care team member. I'm going to search my name. The role is care coordinator. I'm a care team member. And I'm going to click the little button that says lead CC. And of course that brings up the reason for lead CC change. And I'm going to select patient family request. And I'm going to hit save and close. All right. So if I go back to my patient list, I'm going to come up here. Page. I'm going to hit the refresh button. And of course, it's going to disappear because it now will contain data. So it did disappear. It's not going to show. So that's just a little overview. I know it seemed a little confusing, so hopefully I did it in a clear way where folks understand. So that is just showing that folks have a completed shared care plan and ensuring anyone that has a created and completed shared care plan also has a lead CC, which helps bridge kind of the gap in to ensure that folks are accurately care managed. Next, I'm going to just go over how to reactivate a care team member. So again, I'm in the active patient list. And I'm just going to go in and select any patient. Let's select Edwin. All right. So again, we're going to go down to the care coordination selection. This is the current care team. I'm going to hit the grid view. These are all the active connections for the patient, and I'm going to go search for all inactive connections. All right. So we see here that Danielle is an active connection. Lots of times, the reason why this is important to show, for instance, if we were trying to reactivate or add Danielle and we just clicked add care team member, it would give you an error. So if you find that you're trying to add someone and you know that they are active in Care Navigator and it's giving you an error and saying that they cannot add care team member, it's always helpful to come in and check inactive connections, because it might be that someone was deactivated for 90-day deactivation, or for whatever reason they became inactive on a care team. So it's always helpful to kind of troubleshoot and see if perhaps that person that you're trying to add is in the inactive connection view. So say Danielle was the person that I was looking for. I did find her on the inactive connection. I'm going to click that and it's going to activate these selections. So I'm going to click activate and then confirm and activate. Okay. And if we go back to Edwin, And current care team. And we go back to all active connections. Of course, he has several on here. You'll see that the Danielle Palmer that I activated is now on there again. So that's just helpful to kind of toggle back and forth. So these are the active connections. And to see any inactive, you just do inactive connection associated view. And you'll see now, since I took Danielle off of there, Danielle is no longer on there. So we are all set with that. All right. I'll pause for a minute. I don't know if there's any questions or if Robin wants to add anything before I go into the prioritized patient list or show folks where it is. Is there anything that you want to add or any questions?
Yeah, thank you, Erin. I don't see any questions at the moment.
Is there anything you would like to add?
Yeah, I wanted to just let folks know, thank you, Erin, for, of course, this great overview of these items. I just wanted to let people know, we've been having a lot of conversations across the health service areas about the changes to the updates to the care model for 2022 and the fact that how we use Care Navigator will be shifting and it won't be required to generate payment. But I do want to remind people that, it's October, we still are in the 2021 year, and Care Navigator utilization is required for the payment model, and it also is required within our care coordination model. So all of those things that you've been focusing on, both in your presentation, Erin, but also what people have been doing in the field around collaborative care, joining care teams, collaborating with the patient to identify a lead, as well as recording important information in Care Navigator, such as the encounter frequency for people who are high and very high risk or another risk level. Those are still important things to be doing this year, but until January. So thank you, Erin, for highlighting these points. And of course, Tracy and I, the help desk team, and our new care coordination implementation specialist that many of you will meet soon, Kaya, will be available to answer questions as we move closer to the new year. But we do still need to continue with Care Navigator engagement as we have up to this point through the remainder of the year.
Perfect. Thank you. All right. So with that said, most of what I was saying previously does have the reflection of what Robin was just going over. So I'm just going to shift into something that we are kind of in the midst of still developing, but I would just want to show you, I know folks have been working on it a little bit, the prioritized patient list. Now this is available to folks with attribution. And they are able to see that by going to the active patient list. So when you're in the main screen, you would go down to Care Navigator and then the patient list. And that brings me to my active patient list. And you'll see these three reports are new to us, fairly new. Robin and the clinical team have been working with Care Navigator to offer these. We now have the high ED utilization list, the high IP utilization, and then the medical social risk patients. Now, I don't know if in testing it will return any items. However, if I click that, you'll go ahead and see the active high ED utilization list for me. And then the same kind of goes following for the next two as well. I'll show like the high IP utilization patients that are attributed to my organization or so on and so forth. So that was just kind of like a little bit of the prioritized patient list. I know that maybe Robin has a little bit more clinical perspective on that, but my overview is just to show you where they live. And again, that's in the patient list. So once you're in your active patient list, I'm just going to go back here to refresh it a little bit. Okay. So you're in the active patient list. Usually when you come to the screen, it'll show your active patients or active patients, and they are right here in the system views.
Yeah,
Robin,
thank you.
Yeah, I was gonna say, do you have anything to add with that?
So as you can see, those prioritized subpopulations are pretty easy to access just by the drop downs there. And our request is really for you, excuse me, to go in and view those prioritized populations for your practice and evaluate those individuals for their need for care management, their engagement. We can help you identify which of those patients are care managed. You can, of course, filter the list that Erin's showing you now for some of those process metrics to see that as well. But, you know, we know that people who are using the system frequently have information to share with us about elements of the system that aren't working well or that could be improved. And of course, we want to support them with their needs more effectively. So we are asking that you please review those lists for next steps for those individuals. And I know many of you have. We are reviewing the access report that helps us understand, you know, how many of you are viewing it, from which organizations, and helping us determine, you know, how useful that is for you. So thank you, Erin, for that demonstration.
Thanks. I know my context is not really much. I can show you the technical perspective, but Robin and the care team can, care coordination team can definitely add a lot more insight on how to do the proper workflow. So I appreciate that. Thank you.
Yep, and if you have any questions in the field, you can email, of course, us individually or simply carecoordination@onecarebt.org, and we can get back to you with any questions related to these lists or any other aspects.
Perfect. Thank you. All right. So that kind of wraps up the Care Navigator demos that I had today. And then just a reminder that I had, if you go to the OneCare website, you will see we have all the resources on that page. So I'm going to go ahead and just show you that real quickly. Sorry. So in the home page, I know that we have shifted where the home page, where the resources are. So if you click resources right here, this is our public website. If you go down to providers and Care Navigator support, some of these items are available on our Health Learn, but that is mainly through training and you have to log in. This is our public facing website, no login needed. And just a reminder, I know we kind of have been showing this for several times, almost every user group call. But you can see the resources that are on here. And you'll see it's not displaying this just because I think that I'm on just for the compliance purposes in our secure connection. But this does work, I assure you. It has the PDFs, and then these modules are all active as well. So you'll see some of the items that are on there. They have care team, how to add care team members and all that. So just a reminder that the resource page is right on here. It's under resources, providers, and then Care Navigator support. And just as a reminder, you can always give us a call or you can email us at helpdesk@onecarebt.org. And then Robin also shared the care coordination email. Always feel free to reach out to us if you have any questions. Other than that, if there's, I don't know if there's any questions or if there's anything else that Robin wants to add. I know it's a little short today, but those are just some of the items that we wanted to go over, a little bit of a review for end of year.
Thank you, Erin. I don't have anything else to add. Thank you for the demonstrations. And again, you can feel free to reach out to us anytime with workflow questions, questions about the prioritization list, questions about your utilization of Care Navigator currently, or your thoughts about or questions about that for next year. And just a reminder that we are still in 2021 and the focus does remain on applying the model and all of the processes as they currently exist. So we do not really want to see too much of a shift away from that activity, of course, through the rest of the year. And we know you're doing great work with patients and families and appreciate everything that you're doing. Thank you, Erin.
Perfect. So just have the slide up with our contact information, and that is all good to go. Again, this is recorded and it will be put on the website within, I would say, by Monday. And then we will share the slides that have a little bit more granular detail with the how-tos and the demos that I showed. Other than that, we thank you for joining us, and we will see you, I believe, in December for another user group call. All right. Thank you. Have a good day, everyone.